All right. Well, it is 3:01. Let's get rolling. Welcome, everyone. I'm a quick study. Hopefully, you're only seeing one screen as I share compared to last time we were together. Um, Excited to be with you all for our December office hours. We'll go ahead and jump right in. Hopefully, I'm a quick study. There we go. Here's our agenda for today. Welcome, check. We'll do some administrative updates, some funding updates, and then we'll have a monthly report refresher with Lindsay, and then a BBO highlight where Dana from Ingham will be presenting, and then we'll round it out with some open discussion and Q&A before we close out today. So plugging right along here. Wanted to provide you all with some administrative updates. Holiday time is upon us, and a few folks are going to be away out of office, so wanted to share those with you and some resources. So these are the dates, and you'll get this PowerPoint as well, so you'll have them of when myself and Lindsay will be out of office. Should you need any help with monthly reporting, Kemi will be available, and her email address is listed there. If there are urgent matters during the time that Lindsay and I are out of office, Danielle is available for urgent matters. So think about it before you give her a call on the holiday or shoot an email out. But we don't want to leave you hanging, but we know that some of y'all may be taking time off too. So just knowing it's going to be a quieter time for us as well. There's a new resource on Padlet, so if you haven't been there in a minute, encourage folks to head over and check it out. A community agreement resource has been developed with a list of other resources for you to click on to learn a little bit more. I know some folks may need to re-engage or looking at ways to better align with council members and just coming to consensus and beyond. So those are some really good resources that were compiled for folks. Really encourage you to take a look at it and any other resource on Padlet as well. And then just highlighting our next office hours date, January 15th, 3 to 4. We'll be looking at partnership. Oh, I keep clicking. Partnerships. So we may be dusting off those eco maps. So just wanted to give that little preview to come with that in mind for discussion as well as next steps. So pause there quickly to see if there are any questions before we keep rolling. Okay, I counted to 10 in my head, not hearing anything. We'll keep rolling. Funding updates. So this is exciting. Let me move some of my screen around here. So this is very exciting. Danielle has been hard at work looking to secure some additional dollars for BBOs to continue the great work that y'all have been doing. So Danielle's been able to secure $25,000 for each BBO via some FIG dollars, which is really exciting. So it means a little bit more work on your end for us so we can review those invoices. We're just going to need a new updated budget with the new agreement amount, so reflecting the $25,000 that will be added to that. So if you'd be able to, if you need to work with your finance teams or other folks to provide us with the draft of your new budget, including these $25,000, and have that sent over to me by January 24th. Then we'll be able to review them, and then those dollars should become available in February. So focus for these dollars still need to have that COVID connection intended to support the work that you're doing. So if you need to have that COVID statement of intent as well, just to make sure that everything is still connected. And then these dollars are not intended for mini grants, really encouraging folks to think about some of the other bigger activities that might have a little bit more of a bigger impact or more sustainable impact on the community. So maybe there's something that you weren't able to get off the ground because a lack of funding. Maybe that's the opportunity to revisit that. Maybe it's another opportunity in partnership or to, again, amplify something that wasn't able to be amplified earlier on. So wanted to just pause here and ask Danielle if there's anything else. Keep me honest on these updates here on the funding component here as we get ready for the BBOs to receive some additional funding. See, Brian has a question. Let's see. Danielle, was there anything else you wanted to add before we open up to any questions about funding?
I counted to 10.
Thank you,
Didn't have
Brian.
anything.
Danielle, I'm not sure. You're on mute still. Is there anything else you wanted to add about funding at all? Okay.
Um, I don't think I heard the question, sorry. Or
Oh
did Brian
no,
ask his question? Sorry.
not yet. I asked
Okay.
if you had anything you wanted to share before we opened up to questions.
No?
Okay. All right, Brian, take it away.
All right. Thanks, Cassie. For the good news, and Danielle, thanks for the work that you put into it to bring that money to the BBO. So appreciate that. I just wanted to ask about the time frame for spending the dollars. Is that still through September of this year?
Yep.
Similar? All right. Thank you.
Yeah, no problem.
Question.
So, yeah.
Hey, this is
Any
Dana.
other? Yeah, go ahead, Dana.
Just want to say the slide says 2024. I know it means 2025 though, but
Keep me honest. Yes, thank you. Appreciate you. 2025. I'm gonna have to get used to that.
I know, right? Me too.
Thank you. We'll make sure that's updated before we share this out and post it on Padlet. Any other questions before we move on? Okay, 10. All right, here we go. So monthly report refresher, I'm going to turn it over to Lindsay for this next section. Take it away, Lindsay.
All right, thanks, Cassie. Hi, everyone. So just a little bit of a refresher on the monthly report. Some of you maybe have some new team members, and I know that a lot of us are doing work and working to improve like sustainability and doing planning and working on our sustainability plans. And so that may require us to like fill out new sections that we haven't previously like needed to dig into before in the form, and it can be a little tricky. So I just wanted to make sure that we talk a little bit about what and like a sort of level setting, reminding us of what the report is used for. And then I wanted to highlight some screenshots about where you can find the appropriate place to report on your sustainability efforts with your councils. So just a reminder of when they are due. So typically they're due the 10th of the month unless otherwise requested. The only time we request it earlier is during our times when we do quarterly reporting to the CDC. And so that sometimes then we need to ask for it just a couple days earlier, but usually the 10th of the month. And there's some questions about, what is this actually used for? So this is the CDC has set out the reporting guidelines for our team, which we've had to pass down to you. It's also used during our monthly check-in to sort of see how things are going. And then it's rolled up with our quarterly reports to the CDC. We also use what we learn in the monthly reports to try and inform our TA and our offerings, during office hours and learning collaborative sessions. So just trying to get a really good picture of the work that you all are doing with your councils within your community and sort of capture that. So that's really what's done with the reporting. And then the next report is due on January 8th. Again, it's a quarterly reporting month. So that's why you're going to notice a little bit of a different deadline there. And we'll send you all reminders, and then we'll follow up with anyone that maybe needs some revisions or needs a little bit of reminders for that time. So, okay, next slide. Okay, so I know many of you have been wondering, where do I report my sustainability work? And so there's a couple of screenshots here, and we're also going to include this as sort of like a little one-pager PDF that will be sent out with the reporting reminders, so that when you forget everything I've said, you can open up that PDF and then remind yourself where it goes. So there's a section in the reporting called Health Equity Council Internal Improvements and Sustainability, which is PM 3.1. And so then you're going to scroll down to the third green box that she's highlighted here. Cassie's highlighted it, and it asks, has your council made improvements to your Health Equity Council infrastructure? Has your council engaged in sustainability efforts? And so then you would click yes. And then next slide, please. And then after you've clicked yes, you can see that at the top. Then it's going to ask you, what improvements did you make during that month? And so you would click the appropriate box, as many as applies. And then that box, the second to the end, is develop sustainability strategies. This could include planning, having planning discussions. It could include actual like products, like I developed a sustainability plan, or most recently, a lot of you completed your sustainability self-assessment. So that would go there. So you click on that box there, the develop sustainability strategies, and then you would create a brief description of the improvements made. So you describe what you all did. So yeah, a lot of you did that, and some of you I feel like maybe need a little help like finding it, which is fine because this report is very large. So that's totally understandable. I'm going to share my screen really quickly just so you can see how you have to scroll to find the section. Are you looking at the right one? Yeah? Okay. All right. Awesome. So you're here, and this is what it looks like, and you select your organization, and then you've got to keep scrolling as you're filling it out. Scroll, scroll, scroll until you see PM 3.1, which is the internal improvements and sustainability. So then you would say, yes, I did make improvements. You would click your sustainability strategies. And then here you do have to indicate the amount. So let's say I had one planning conversation about sustainability with the council, then I would click 1. And then you just write here what it is that you did, and give us a little bit of information about that. And Kevin's shaking his head. He's like, I don't know what's going on here. So I just wanted to pause there. I'm going to stop sharing to see what questions, if any, you have. And we can always, like, if you're actually the one doing the report and you have questions as you are doing it, please like call me or, email me, and I'm definitely happy to like walk you through it again. But I did want to stop there and see if there are any questions about that particular section of the report. Dana.
Okay, so it seems like if, for example, we have our strategic plan within the health department, and if I've written in the Health Equity Council, but haven't shared it with them, like, would that count? Or it sounds like it's something like that wouldn't count, because I didn't let the Health Equity Council know that I've written them into my strategic plan as far as like sustainability.
I would think it would still count. Cassie or Danielle, like, can you confirm?
Yeah, I would include that as like 1, and then in the description, I would add some of that, what that looks like, where it's housed, how it's communicated to the council as well. So I think that's some really good sustainability of putting it in a larger plan like that.
Mm-hmm.
And a second question, if I'm thinking about language access in my position, but might have a little bit of conversations with a few people on my Health Equity Council, is that something that would count? And this is like like how our building is. Is it friendly to people who don't use English as their primary language, or thinking about changes for how to support people? So that's in the boxes, but it might not necessarily be something I speak with the Health Equity Council about. Or I could just close the loop and update them.
So I think for me, that's a good question. There's a section about like the improvements to the council as a whole. And then there's a section right below that that talks about improvements to the backbone organization, so Ingham County. So I think
Okay.
it depends on what is being improved. So if you feel like you're making those language accessibility improvements to your own organization, then I would plug it into the backbone
Okay.
internal improvements. But if it does apply like to the council overall, then I would put it in right there.
Okay, thank you.
Yeah. And we can talk more on Friday when we meet too about like those specific
Thank
pieces.
you.
You can tell us more. Yeah, absolutely. Other questions that have come up about reporting or specifically sustainability reporting? Okay, I'm gonna turn it back over to you, Cassie.
All right, let me pull up my slides again, and then we will be hearing from Ingham County as our BBO highlight. Just a minute here. Okay, Dana, passing the mic over to you, and just let me know when you'd like me to click to the next slide. Thank you so much for being our highlight BBO, talking a little bit about, again, these are from following back up with some of our BBOs or with you all with regards to the self-assessment, sustainability self-assessment, and areas in which you and your councils have identified success, mastery, or just having some really good lessons learned, best practices that we'd like to share with everyone. So I'm going to mute myself and pass the mic over to Dana.
Thank you. I'm just gonna turn on my timer so I can make sure that I don't talk too much and stick within my allotted time. So hi everyone, my name is Dana Watson. I'm here at Ingham County in Lansing, Michigan. My pronouns are she, hers, and I am on the call too is our other HEC admin team members, which is Adam, Jason, who are on the CAHA end, as well as Keontae, who's with me here at the health department. And you can go ahead to the next slide. And please, Adam or Keontae, feel free to unmute yourself whenever you'd like to, if you've got something that you want to add. And Jason has a particular slide, as I said. You too, Jason. So just a little bit about our composition. So again, it's Ingham County Health Department and Capital Area Health Alliance. We work together to do the administrative work and also organize with the groups. What we saw year one when we first got the grant was we were able to offer out 15 mini grant awards to 15 different community-based organizations. And then for year two, we granted out 13 awards to 13 community-based organizations. And some of them came back forward from year one. Others were brand new ones. And that was one of our goals to get the word out more and also hopefully see some new community-based groups that are doing great work. So for year two, this year, we wanted to increase the number of council members that we had. And so we were able to add 3 more council members to our Health Equity Council. Our council members are paid for the work that they do. So we try to write that into the grants so that that monetary value is there. And it's been a goal and happy to report. People will look at us as we see more state and federal dollars being passed to the counties, and counties who are more in touch with the community organizations able to distribute those dollars. We're able to talk about some best practices within Ingham County Health Department as far as how you make it an equitable experience for your small and your large organizations, as well as like how the scoring goes, et cetera. And just pride ourselves too on lessons learned. I am about 2.5 years into my position, and some of the parts of what I'm doing was new, and there's a lot of moving pieces because we've got us here in Lansing, Ingham County, we have people in Mason, we have accounting teams and all sorts of things that can cause delays, et cetera. So go ahead, and unless someone else has anything else to add on that one, thank you. I'll just pause for 2 seconds. Anybody else want to add anything?
Nope, Dana, I feel like you hit it right on the head with what you shared.
So, thank you. All right, next slide, please. All right, so next one is sustainability of our Health Equity Council, as well as the money piece of it. So as we thought about how to sustain the Health Equity Council, because we began by paying them, and so we don't want to end by asking them to volunteer their time. And in the past, through this grant specifically, we were able to fully provide for our Health Equity Council members. But as we all know, the dollars changed. And so that meant especially through encouragements from you all, MPHI and MDHHS, is thinking outside the box and thinking about other opportunities to fund our Health Equity Council. And so we also wanted to make sure, so no, first I'll start with, we had a FIG opportunity within Ingham County Health Department, so Public Health Infrastructure Grant dollars. And so I was able to apply, and it was accepted so that I could fund our Health Equity Council members, as well as fund people who come outside and work with me to co-facilitate health equity, social justice workshops, and implicit bias trainings. And so the FIG opportunity has been so exciting, and we've never really had opportunities internally where we could apply for dollars and then, get it accepted and be able to distribute those. And so, again, that felt really good because we were able to financially support our Health Equity Council, because they were not written into the most recent budget that we had to submit. And the next thing I'll mention is fiscal responsibility. So our Health Equity Council members, when they began, it was a smaller group. It was a larger lift as far as what we were building. And it took, I would say it took more time, but we wanted to talk about matching our council members' attendance to the pay, as well as the time commitments to the pay. For example, when we distribute like our Google form to have them fill out for the sustainability piece that you all were asking for, if just 10 members, which is a good number, but 10 out of the 14 filled it out, we wanted to be more fiscally responsible and make sure those folks could get paid, but the others, it's okay, it happens, but that they wouldn't all receive the same payments. And that will help us save money, but also, again, I'm not going to be asked questions by my supervisor, MPHI or MDHHS, about, why such and such person who hasn't attended is still getting, full payment. And so our future is looking at multiple funding streams for our council. For example, we talk about the social determinants of health hubs that we're trying to form, and how our Health Equity Council could possibly play roles in that, and how we could just continue to uplift their voice. And the last thing I'll mention before the next slide is what's changed is we had 15 council members. One council member moved to Virginia, and so we decided not to fill that seat. And so again, that left us with more money, as well as, like I talked about, the new pay structure that's tied to attendance and participation. And just again, we lead in a facilitative way. And so our Health Equity Council definitely weighs in and gets to give opinions if this is the direction they want, or if they want a different direction. Next slide. And I'm passing to you, Jason.
Thank you. So I had the honor to work with Dana as I kind of was moving to the area and really trying to familiarize myself with a lot of the organizations that are in the area, to make sure that we are being intentional about making sure that all of our work is built around community collaboration. Dana had already had a framework in place from a previous Ready grant, excuse me, where she had existing partners, and it was one of those opportunities where she and I sat down and we just said, hey, what can we do to make things better? So within our grant, and our, using the sustainability checklist that was provided by the state, and just really just trying to look and just make sure that we are trying to implement a lot of those practices that came up from that checklist in which our Health Equity Council has shared. We recognize that we really needed to strive and reach back out to previous and current funded mini grant awardees, as well as enhancing our existing partnerships with our Health Equity Council members. So I am happy to share the Ingham County Health Department and the Capital Area Health Alliance was selected as a cohort four for the social determinants of health hub sites. And one of the processes that we really value is really just trying to make sure that we are soliciting feedback from our community partners along the line of every, I just want to make sure I say this right, along the line of every aspect within the grant process. So either that's requesting grant letters of support, inquiring what services each partner can provide. I look at this as a best practice, as Dana has said several times, just because it allows us to kind of minimize that overlap. So, which is going to be very important as we are looking to get the hub site up and off the ground in January 2025. So another opportunity that we were able to secure was, and CAHA did it, but I actually had some help and support from Dana and Health Equity Council as we were going after Ready grant funding, so the Racial Equity Data Initiative grant funding, which fosters environmental justice as it pertains to pollutants that affect the BIPOC and migrant worker communities. So I really feel as if this is just, once again, a wonderful opportunity for us to really just kind of just take a step back, survey what opportunities are in the area, and really try to move forward with sustaining the work that the Health Equity Council is doing and plan to do for many years to come. I will honestly say that we have had multiple meetings where we're even looking at the internal aspects of how are we sharing our partners' work? How are we just really just making sure that we are telling the stories of our partners? So the last thing I would like to share is that, and Dana doesn't know this, but I kind of did some math, 30 plus organizations have been supported through our efforts, either through our mini grant process, through the grants that we have written. Like even for this Ready grant, I was actually able to bring in 3 existing Health Equity Council partners. And then there are some adjacent partners that are supporting us. And so we take some of those dollars to support some of the work as well. Or we may find ways to take the grant programmatic dollars. So we have to do listening sessions. And then I will actually reach out to one of our Health Equity Council partners and say, hey, I know you have some individuals that you're working with. Let's find a way to, support you with giving your clients, listening session, gift cards for attending, and then CAHA has a little bit of extra dollars. So we will typically say, hey, we'll cover food for you. Just get them in the room. So little stuff like that. So I know the next slide is the end of the slide, but I did want to open the floor because I kind of mentioned some of the internal stuff, and I know Keontae was working on some of that stuff too. I just didn't know if he wanted to highlight some of the things he was doing. If not, I will end it there.
I did want to interrupt, and I'm sorry.
Mm-hmm.
We ran out of time.
No,
but we did share what we were asked to share, but yes, but I saw Lindsay say no time exists. Time doesn't, it's just man-made time.
You
So-
can
so
keep
yeah.
going.
You
Yes,
go.
you can keep going.
All right, go ahead. Keontae and Adam.
I just for the sake of time, I know it is real and not real all at the same time, but I'll briefly just kind of go into some of our efforts to improve the sustainability as it pertains to internal and external communications to the community. So internally, just interview processes to make sure that things that we have going on, as well as our organizations, our community based organizations have going on, and making sure that the goals are in alignment with what we're doing, making those on a more consistent basis. So that way the communication loop is more consistent, more concise. And, we have more, to report on and create sustainability, as well as external communications, opening up opportunities to folks out there in the community. So whether that be community-based organizations that we have not yet had a chance to touch, or individuals who want to partake in different trainings or equity based opportunities, learning skill sets, those kinds of things. So definitely a lot to come on that. I won't go too far into detail just because we're still working through, but those are that's a big part of the sustainability as we look forward. Not only is it the funding, the grant writing, and making sure that there's access to resources, but I think the communication is a huge part of that as well. And so as we're continuing to build out that framework, we'll keep you guys updated.
It is Adam. To continue what all my colleagues are stating, I love that we are leaving a legacy of health equity in our community through the documentation that we're doing, whether it's the photo voice, whether it's what Keontae was kind of talking about, which is kind of having a newsletter, and also our webpage as well. I think those ways that we can be a resource as we continually leverage resources to help impact health equity in our region. So that's all I got.
Excellent. Thank you so much. That was amazing. I was taking down some notes myself of like how intentional and thinking about those funding opportunities, because you can get mission drift often, right? Depending on, what a specific proposal might be asking. So the intentionality behind reducing duplication of efforts and looking at other issues, environmental justice, who's in that space, how do we pull people back into this work, to have more partners either supporting the work already and existing, and maybe even being able to help move things forward depending on what the issue is. So that's really exciting stuff. I'm gonna zip it for a second and see if there's any questions or comments folks have for our friends in Ingham.
Kelvin has his hand up.
All right, Calvin, take it away.
And I couldn't let this go by without asking some questions, right? I love what you guys are doing. And I think that across the board, it seems like we're faced with similar challenges. And so how y'all addressing them, I think it is a great thing. And thanks for being the lead in this presentation. The question is, and maybe it was said, right? It's a two-part question. One is about the hubs, right? And the second one, which will be the first one, is about CHA. Was CHA a part of the council, or was that some entity that you guys connected with when y'all developed your sustainability plan? I suppose I'm asking. And the hubs, the question for the hubs is, what do the SDH hubs intend to provide for, community decisions?
Sure. I can take the question. Was it the CHA, or CAHA, Capital Area Health Alliance?
CAHA,
Yes.
Capital Area Health Alliance.
Yes. And so this grant, our current grant was written before I was hired, but I had been a part of like the READY group, the Racial Equity Data Initiative, even in my former position. And we have relationships with Capital Area Health Alliance. And I know, Jason, you can say this a lot better because he's the director over at CAHA, but it was a great place to go in when CAHA would hold meetings and gather with like the YMCA and other health centers and our local hospitals as well, and talk about things, whether it was walkable communities or other things. And it's different now, but the work that they do is just intricate in our health department work. So they were like a natural partner as far as doing this work together. Um, Jason and I have a really good friendship, and my boss will ask me, she's like, "So did you guys know each other before?" And it's like, "No, we didn't
Nope.
know each other before. It was just like, just good stuff." I knew the former executive director as well. And so, like I said, being able to work with Capital Area Health Alliance was like a natural fit for us and work that we do and we can do better with CAHA with us. And Jason, may I pass to you on the
Absolutely.
SDOH Hub piece? All right.
Yes, so I actually have the social determinants of health hub funding priorities is what they're looking for. I feel like that might be helpful, Kelvin, if that's okay. Community health worker training, hiring, and integration is the first funding priority. Community information exchange, planning, and implementation. And the third one is implementation of holistic interventions that address social determinants of health, utilizing a health in all policies framework. And so basically, just in a nutshell, do you already know what health in all policies before I don't want to insult anyone by saying what it is. So you may already know what it is. So, all right. And then some of the impact that they would like to see is a development of foundational infrastructure that can adapt and expand over time, increase accountability and transparency, increase alignment at state and local levels across healthcare and social care. Cost of health and social services will decrease, increase in commitment to community-driven work, and reduce health disparities. And there may be a hub depending in wherever you're located. There may be one already in existence, and if there is, then it's just reaching out to that BBO to see if you can participate in some way. I believe Brian, you have one, right? I see you on my screen, so that's the only reason why I threw you under the bus.
Yeah, we have a hub here in Kent County. I mean, it's like, it's conceptual right now. So it's not like we don't have it going yet. And actually, we have, 2 funded hub sites in Kent County with United Way, as well as the health department. We each kind of have different components of that, like Jason was talking about. So United Way is working on the community information exchange. We're kind of tangentially connected to the community information exchange as well, but we're kind of working with our partners to kind of build, the overall hub with all those different components that Jason mentioned. So yeah, we're in kind of our initial phases of trying to get this to work.
And the hubs, Calvin, just so you know, the hubs do receive dollars, but majority of that will go back into the community work. So it's not like it's going to stay in house and everyone hoards the money. It really is about either building those collaboratives in the area. So yeah, I hope that answered the question. I know I was probably talking a little bit too long, but there you go.
No, thank you guys. Y'all provided me with some great information. And Brian, starting the hub, I need to see some stuff, Brian. We gotta connect, seriously.
Yeah, definitely. I know we were trying to do that last year, but we just gotta make that happen. But Jason, while I have you, I was kind of curious as to what you mentioned. January was kind of going to be your kickoff, and I was just curious to hear more about like what your hub, at least this initial hub pilot project, will be focusing on.
Okay, so I will be totally transparent. I have to work with Ingham County to identify what we would like to focus on. There has been several ideas shared either around housing or around SDOH. So I know that I would love to see us work on SDOH because it's a great fit for what our health equity council is already doing. But once again, it's all about community feedback. So our community may come back and say, hey, focus on this instead. But I am hoping, I'm being political in my response, so please forgive me. I'm hoping that we're focusing on the SDOH because that's, we already have that framework in place. If you think about Health Equity Council and the work we're doing and building in those existing partnerships, that's where I would like to see us. I did create a work plan and emailed it to Dana, but I have to wait to see if Dana liked it or not. So, everything is still a work in progress, but they said our actual start date. I said January, but January is like the, kind of getting things started. But our actual programmatic dates for running the hubs will be actually April 2025 through September. It's more of a planning phase, but I know we have to kind of get things going as early as January.
Got it. All right. Thanks.
I hope I answered your question, Brian. I'm not
Yeah,
trying to.
no, that's great. I mean, I didn't know
The
that.
money has to go to Ingham County first,
Yeah.
and I want to always make sure I honor their participation and leadership in, making sure we get this off the ground. So
Yeah, it's great that you're having the, voice of the community drive what you do too. So that's great.
thank
So,
you.
thanks.
Thank you.
Absolutely. I wanted to lift that up too. I love how you had said, here's what we're thinking, but we want to check with community, also making sure that our partners that are already engaged are in support of this and or can see themselves in the work too. So I think that's really, really great. Again, highlighting the intentionality behind it.
Yes. And if anybody has any questions around grants or if I can ever assist with just providing some feedback, if you're not astute with writing grants, I'm always available. You all should have my email, my phone number, and I'm always happy to help.
Excellent. Any other questions, thoughts for our friends in Ingham and the great work they're doing?
I just wanted to say really great work. It's really cool to see all of the different connections that y'all have created and how you're really looking towards the future, Dana and Jason, and is Adam here today? I know Keontae is here, so and Keontae.
Yes, I'm
And
here.
so, oh yeah, there you are, Adam. I was like, I thought I saw your name. And so, continue to have the really great ideas, continue to share, really always encouraging folks to either volunteer to share or reach out to other councils or BBOs to learn from one another. We had I think a check-in with Macomb this morning where they mentioned really wanting to have some of their council members meet other council members from different areas and kind of learn from one another. So just wanted to throw that out there as another potential way to create some connections or share some ideas with each other.
Thanks for that. Well, I won't pull up my screen because it may kick me back out. But our last slide was really just kind of an open discussion, any Q&A that folks might have. Oh, Sue came off mute. Sue, go ahead, take it away. If you have any thoughts, floor is yours.
Oh, is that me, Sue, from Macomb? So I'm with Macomb Health Equity, and I come off mute just to say thank you to Danielle for raising that. We as a council are really looking at collaborating with other health equity councils and sharing ideas, sharing what's working, what is not, and how do we build a a larger voice collaboratively. So our council is really interested in advocacy, both local, state, and federal, and advocacy around advocacy and education, I'll say, of local officials and our legislators. So that is something that I know our council would really love to work and learn from other councils. So I put that out there to say if anyone is interested in that and collaborating with us, we are extremely interested in that. We're also looking at ways for the sustainability. So I love hearing about the different grant opportunities and ways that grant monies are being used to support and sustain long-term the work. So that was my comments and feedback, and thanks for the space to say that.
Yeah, absolutely. And thank you for that. Yeah, I think that being able to see, and I think maybe I said this on the last call too, seeing each other as partners in this work, whatever that looks like, could be just a phone call. It could be bouncing ideas off one another. Or, hey, have you come across something like this, right? Yeah, really lifting that up of knowing that you've got a lot of folks across the state in your corner, trying to continue to move this work forward. So whether that's something collective to work on or just, supporting on a one-to-one basis, I think is really awesome.
I was going to say, if we thought about a planning team to bring people together, maybe for an hour or two virtually, I'd be happy to be a part of that, and maybe perhaps a subgroup could present to everyone on what we're thinking and where we're going. Because yeah, I love learning from others that are doing similar work, but just in different spaces.
Awesome. That's great.
Yeah, that would be great. We would, as Macomb Health Equity, also join in on that.
And Calvin said he's in too, in the chat. Excellent. Okay, well, we're continued our open discussion. Any additional Q&A folks might have as we round out our time together today.
I think so. I will just say that, Dana and Calvin, if you'd like, I'd love to connect after the holidays and see how we could move that forward.
Sounds great. I wanted to share, as far as my health equity, our Health Equity Council goes, I love being able to lean into them as far as us seeking direction, whether it's internal decisions, letting them know what's going on with clinics or closures or deficits, to externally what we're trying to do. I love being able to report to my team, which is predominantly white, probably 99% white, middle class, upper middle class folks, that I'm not saying this on behalf of myself, but the Health Equity Council recommendation is there. And that's part, to me, of that participatory democracy that I told someone recently today in a meeting. I'm just getting more deeply invested in this vision that we have our expert angles, but it being community led and the people who are most harmed giving their opinions, and participatory democracy is where I'm going and where it's at. So just love being a part of this.
That's awesome. Thank you for sharing that and for leaning into it too, right? 'Cause sometimes it can probably be a little scary. So I think that's really great. And then you have that to lean on with your colleagues. Excellent. Well, I'm not going to keep you. any longer then you need to be here, but I appreciate you all so much. We will be meeting in 2025, January 2025. And I just wanted to, knowing that I'm newer to the team here, still just extremely appreciative of all the work that you have done over the year. 2024, and I know we'll have a lot of opportunities to connect in the new year, maybe some new challenges, some new successes and celebrations as well. So really looking forward to that time. And again, we'll send all of this information out to folks. Check out Padlet, it'll be on there. You'll have those dates for any out of office, but really appreciate everything that y'all have done in 2024 and looking forward to continued partnership into 2025 and beyond. So have a great holiday season, stay warm, get rested, do whatever you want to do. I'm not going to tell you. Enjoy your time, and we'll see each other in the new year, if not sooner. Thanks so much, everyone.
See you, everybody.
Take care.
Thank you, everyone.